So we're here with Dr. Lynn at Glaucoma 360, and a question I had is MIGS is such a big part of the presentations we're hearing. Where does MicroPulse fit into that?
Yeah, that's a really good question. We, at UCSF, we had done over 100 cases when we looked at sort of our first 60 cases of MicroPulse in a whole range of glaucoma, all the way from sort of moderate glaucoma where a patient can't tolerate multiple medications and they have primary open-angle glaucoma, all the way to more end-stage glaucoma, the traditional glaucomas we think of for cyclophotocoagulation. We've had really overall excellent results where the IOP lowering was about 25%. The success rate, if you want to call it a success rate of 20% IOP lowering or more, was over 66%. It was about 68% in our study. And we did not find anybody with any severe complications, so the average vision preoperatively and postoperatively was the same. And so we've had good experience with it. I think practitioners who want to take it up really should get some direction with it in terms of how others have used it, including myself. I'm happy to help others in terms of instructing with that.
And what are you finding are the best candidates for this procedure?
We've used it in a wide range of patients, all the way from patients, again, who have more moderate glaucoma where they like to get off the medications or they're on max medications. And maybe the next step would be obviously a surgical procedure like a trabeculectomy, but they really don't want to have the potential complications of trabeculectomy. I mean, all of my colleagues are always very open about, the idea that warning the patient that there's going to be potential complications with a tube or trabeculectomy. And in those kind of patients, this is often the most common type of patients I have who understand and they have this alternative where the complication rate is much lower and they have a fairly good chance of having IOP lowering without a penetrating intraocular procedure.
Mm-hmm. Okay. Is there any recent clinical data that you're able to share with regard to MicroPulse?
Yeah, some of the published data probably are similar to mine as well, that maybe about 50% or more have a good success rate in lowering the intraocular pressure. Usually it's around 20% or lower. We had probably toward the higher end of 68% had a significant IOP lowering, in a way keeping them from having to have a penetrating surgery. There have been, of course, there's always potential for complications, but I think those are relatively low. I think you always have to compare it to other procedures, and when you look at things like trabeculectomy and tube, which have very high rates of complications, it's relatively low with MicroPulse.
Mm-hmm. And how is this useful or relevant for the average ophthalmologist in their day-to-day practice?
I think for me it became sort of my number one procedure once I realized that, okay, here are the parameters I want to stay within in order to get my effect, but also not to overtreat, so to speak, and get potential risk for hypotony, vision loss. And so it really became, again, for me, the number one procedure for lowering intraocular pressure. And I think for ophthalmologists in general, as they get more comfortable with what parameters that they would want to use, they may be able to have this as their first consideration for their patients as a procedure.